Good morning and welcome to the Compass HIIN office hours call. Before we begin this morning's session, would just like to review a couple of housekeeping items. I think most of you are familiar with the Zoom format, but we'd like you to keep your phone lines muted and avoid placing your phone call on hold. Also, there is going to be a lot of opportunity for you all to ask questions today, and so would encourage you to navigate to that chat box and make sure you can find it, and encourage you to enter questions as they come to mind or comments as you think about them throughout the course of the session. Finally, today's call will be recorded and transcribed, so if you've got team members that missed it or would like to refer back to the content shared today, we will be circulating a recording link to the session today, along with a slide deck to everyone who is registered, along with sharing on the iCompass platform. So with all that information in mind, we'll go ahead and get started. My name's Kate Carpenter. I'm the Director of Hospital Services here at the Iowa Healthcare Collaborative, and it is my pleasure to welcome you all to this special March office hours call. Our Hospital Improvement and Innovation Network has been a really powerful force and rural network, particularly in the past 3.5 years, and we've gained some really incredible national recognition for the work that you have all collectively done on both reducing readmissions and also healthcare acquired conditions. So we're grateful that you're here. In today's session, we're going to be, of course, celebrating your successes and efforts, but really spend some time focusing on how, as a network, we can navigate through this next program transition efficiently, and also kind of prepare your minds for some of the exciting new opportunities that lie ahead, while also kind of balancing the need to support you in your continued sustainment of the work and progress that you have made to date. We are going to review some of the FAQ questions sent out just a couple of months ago, and most importantly, be providing you an opportunity to ask questions and get answers back from our team. So just a bit more context before we get started. I think many of you know that we are approaching another exciting CMS program transition period, and so with that transition has come many questions over the past couple of months. And we absolutely understand. I think the flow of information never comes as fast or as frequently as we want it to, but we've been very patient and feel like we do have enough information that we'd like to share with you that CMS has shared with us. So we've done two things specifically in the past couple of weeks to try and get this information out to you. First, we did put together an FAQ to try and put out a timely communication and answer some of the more burning and common questions that we've been hearing. If you didn't get that FAQ or haven't had a chance to read it, I think our program support team is posting a link to that in the chat box and comments so you can access it if you'd like to. So we'll be reviewing those today and hopefully providing a little bit of additional detail on those responses. And then secondly, of course, scheduled this office hours call in hopes to elaborate on some of those answers and provide you some more insight that we gained when we attended the CMS Annual Quality Conference in Baltimore last week. So with that, we'll go ahead and jump into some of the questions we have been hearing most frequently and were included in that FAQ document. The first question was, is the HIIN ending, and if so, will there be a new HIIN-like program? Pretty common question, and as you know, or most of you may know, CMS is preparing for another transition to a new program, and that has been forecasted to begin the end of fiscal year 2020. I think in the original FAQ, we had forecasted that they thought it may be July. That still could be. At the CMS Quality Conference last week, they did generalize this and say by fiscal year 2020. So that would be the end of September. So sometime in summer to early fall is current forecast for this new program to launch. And as you likely do know, the current HIIN program is scheduled to conclude at the end of March 2020. And so I thought it might be helpful to just sort of remind you all, many of you are new to your roles since the HIIN program initially launched in 2012, and even more of you may be new since the HIIN program launched in September of 2016, so thought it might be helpful to take a look back at where we've been so far and kind of how we have gotten to this point. The first HIIN-like program was the HIIN 1.0, the Hospital Engagement Network. That actually started as a CMS innovation project, and it ran for 2 years from 2012 to 2014. And they got really incredible nationwide results in working with hospitals on these important quality and safety metrics. And so they took a little bit of time to see how can we move this program and get sustained funding to continue this critical work. And in September of 2015, that's when they launched the Hospital Engagement Network 2.0, and many of you remember that, and it ran for an additional year. You'll see when we did the jump from HIIN 1.0 to 2.0, there was a little bit of a transition or a gap period, some might call it, while they got everything ready for the next program launch. And then most recently, when we moved from the Hospital Engagement Network 2.0 to the Hospital Improvement and Innovation Network that started in September of 2016, we've had the privilege of leading our network in that work for about the past 3.5 years. And so what we're really talking about today is CMS and IHC preparing to make this next transition and leap to the next exciting hospital-focused piece of work coming out of CMS. And you don't see the jump on the screen, but like I said in the previous slides, we are anticipating that that will happen sometime this summer or early fall, and kind of helping prepare us for that transition of time as we prepare for the next scope of work. The second question was, will IHC apply to be the lead organization for the next CMS HIIN-like or hospital-focused contract? We say HIIN-like or hospital-focused because we know it's very likely that the name of the program will change. It won't be called the HIIN anymore. It may be called something similar but slightly different. And so the quick and easy answer to this is yes, absolutely, and we're really excited and thrilled to do so. We have a team here already preparing based off of the information that CMS has released so far on some new and exciting approaches we might take to this work. But before we get into that, I just wanted to remind you, I think it was back in the fall, Dr. Evans had presented on a webinar on moving forward, and he shared some of this information, but if you missed it or maybe need a refresher, I just wanted to remind you that CMS is kind of taking a new approach to implementing their quality improvement programs. They have started a new umbrella called NQIC, or the Network of Quality Improvement and Innovation Contractors. And this new umbrella is where their new Medicare quality programs now sit. So that would include the QuIN/QOs like Telegen here in the state of Iowa, HIINs, PTNs, or sometimes referred to as TCPI. That's sort of the HIIN-like program geared at the outpatient setting. And then ESRD networks, plus potential new programs that they may decide to launch. And IHC did go through a competitive bidding process back in 2018 to become an NQIC contractor, and was awarded as one of 59 organizations across the country that as of January 2019 were eligible to compete for those NQIC programs and contracts that CMS is now referring to as their task orders. So IHC, again, is preparing for the new program, and feel like we're really uniquely equipped to meet Iowa hospital and rural needs in the next scope of work. Moving on to question 3, what will be the focus or goals of the new program? And so I would just say that while there's a lot we don't know, because the application or the what people refer to as the RFP or request for proposal has not been released, there are some things that CMS has shared that we're pretty excited about. CMS, under this new NQIC umbrella, has said, no, we're not going to have the QIOs working on A, B, C, and D, and HIINs working on G and F, and outpatient providers working on X, Y, Z. We want to have, no matter who the contract is for, who the task order is for. We want all of the work, regardless of the setting, to be focused on really propelling outcomes in these 5 areas that you see on your screen. Improving behavioral health outcomes, focusing on decreased opioid misuse, increasing patient safety, increasing chronic disease management, improving quality of care transitions, and also long-term care quality. And so the ones that you see highlighted in red are the ones that CMS has verbally communicated to us will be the 3 focus areas of the HIIN-like task order. So hopefully, I think, like us, you'll see some similarities in the work that we do now, and potentially some, new opportunities to grow those places out as we look at behavioral health, opioid misuse, and care transitions as a more broad topic than simply readmissions. We may have an opportunity to look at super utilizers and some of those things. So with that said, while all CMS programs are working on those 5 goals, it's an expectation that they have set moving forward that no matter how we do the work, that we have focus on these 3 areas as cross-cutting priorities, that we really improve outcomes for vulnerable populations. There'll be a tremendous, absolutely huge focus on rural health and small practices, and also underpinning of including patient and family engagement in all of our efforts. So I think while there's a lot we don't know, knowing these things helps give us the information we need to prepare for that application when it comes. And we as an organization are incredibly excited to see rural health on the priority list, and excited for you all to become national leaders in this area. Question 4 is the focus area seems similar to the focuses of the new QIO or QIN work and the initiatives they're putting out currently. Is that correct? This is a question we'd received numerous times about a month ago when Telligent started advertising for their new QI Connect programs. And so the simple answer is yes. Like I mentioned in the previous slide, CMS is asking all programs to work towards improving outcomes in those 5 goals. They've created alignment of the programs, and so we can all be working together on advancing a common set of aims. And so then it flushed out the additional question, did your hospital have to sign up for the new QI Connect affinity groups? And so here's what we've been able to pull together from the information Telligent has disseminated in our partnership conversations with them. They have extended the invitation to join their virtual affinity groups to various settings across the states that they serve. This list would also include hospitals and ED leadership. Signing up or your participation is not required for hospitals, and we just wanted to note that QI Connect does not take the place of HIIN and or the future hospital-focused CMS quality program. The QIO task order in general was awarded, as you know, a couple of months ago, and their primary focus areas are really going to be working with long-term care and also building community coalitions to advance those 5 aims. And as we all know, the hospital's definitely a leader and a key stakeholder in those community coalitions. So they made it a point to extend invitations to all the different stakeholders you might find in a community. During the months of April to June, and we might even extend this out to July and August, depending on when this next project launches. There's a little bit of unknown there. Well, IHC is transitioning to prepare for the next HIIN-like or hospital-focused program. What will happen? What can the hospitals expect, and what should hospitals do? I think there's been a lot of questions in this area, and for good reason. And so we wanted to go through a couple of things that you can expect from us in the couple of months or in the months to come, and give you an opportunity to ask for clarification on anything that we don't address. To start off with, the IHC clinical quality consultants will remain accessible to you. Our team is still here. Our team is still active. Our team still wants to engage with you and support you in sustaining your efforts today and to continue the momentum that we've built in the core focus areas. The database will remain open and active so that you can continue to report your key quality metrics and access the reporting tools available to you through the database. We know many of you rely on those tools to report out to various quality groups and leadership at your hospitals, and we want that data to remain available and accessible to you throughout this period. Hospitals will also continue to receive monthly newsletters, information, resources, tools, and education from IHC during this transition period. If you have, the only real caveat to this is we have transitioned away from the prior online format that many of you had registered to called HIIN. We've moved to a new iCompass format. The link to join is there. We are daily sharing a lot of resources and activities. We think that you'll really enjoy this new platform, so would encourage you to sign up if you haven't already. With all of that said, I won't read all of these slides word for word, but I did want to take the opportunity to tell you there's some of the new tools and resources and education we have coming out specifically in the next 60 days. IHC just released a new hand hygiene auditing tool. You can find it on the link below. It captures kind of those 5 moments of hand hygiene. Also, IHC and the Iowa Hospital Association have partnered recently with IDPH to provide, again, free naloxone nasal kits. And so would encourage you to use the link included in this slide deck to learn more about how you can request those kits. And then upcoming data, as we mentioned, the flow of quality improvement data will continue to flow through this transition. And so we will continue to disseminate the reports to hospitals in accordance with our annual reporting schedule. This means that in the month of March, that quality leaders at hospitals can anticipate receiving their run charts and dashboard reports. We encourage you to take a look at those to make any corrections within the HIIN reporting database that you might need to make, and then we will re-pull those and run them again and disseminate them to hospital leadership in the middle of April. We do have some upcoming education and events we want you to make sure that you know about. Many of these were listed in the drumbeat that came out this week, but next week is Patient Safety Awareness Weekend. We have done some due diligence to try and compile some of the free education events going on across the nation for next week, and you can find those listed all together at the link below. The IHC Annual Forum and Poster Symposium is coming up in just a few short weeks on April 15th at the Ron Pearson Center in West Des Moines. And if you haven't had the chance to, I would encourage you to register or take a look at the brochure. Lots of great opportunities to engage with your colleagues at that event. And I've included a little YouTube link to a promotional video. And then finally, last thing I wanted to mention that is coming up within the next 60 days is IHC is planning a webinar education event to give hospitals guidance on how they can navigate and utilize the Iowa report. So mark your date and feel free to use that link to register for the upcoming event. We'll be releasing a brochure in the next week or two. Moving on to the next question, other organizations have reached out to us asking if we would sign a commitment to join their HIIN-like program in the next contract period. Why are they doing this and what should we do? I think we started receiving these questions probably late last year and into January. As mentioned in previous slides, CMS has not released the next HIIN-like task order or program, and so IHC has not asked you all to sign any new commitments because simply CMS has not given us enough information to accurately represent the new program to you. I would say that no, it's not just IHC that doesn't have this information. No information has been released to anyone. I would just note that IHC, as mentioned before, is one of the 59 organizations eligible to bid for this contract, and we do intend to bid on leading this work in the future and continuing our partnership with you. The Iowa Hospital Association is happy to answer any questions you also may have regarding inquiries you received from potentially other contractors. I would just caution you against signing anything, because likely anything they're asking you to sign is not based off of something published by CMS, as it has not been released to date. A couple more questions. Our hospitals would like to continue our partnership with IHC in the next HIIN-like or hospital-focused CMS program, and is there a new charter or commitment that we can sign? Definitely. IHC and our team have some new and innovative ideas for the next program. As mentioned, there's going to be an incredible rule focus, which will present some really cool opportunities, I think, for both Iowa and South Dakota. Hospitals will learn how participation can be customized to align with your hospital's local strategic plan. We want to reduce the reporting burden for you all moving forward, and also bring in some new offerings that maybe would increase the value of participation for you. We have been accumulating all of your comments throughout the past few years and taking your suggestions, and really plan on synthesizing those and intentionally using them to design the next program as it launches. Once CMS does release the information needed to accurately represent the new program commitments, we will make them available. Trust us, we are very excited to continue the work for you, and we will be sending out that information as soon as it is released. With all of that said, if you do have ideas or suggestions, comments, considerations that you think would be helpful for us to be aware of, please do. Now is the perfect time, if there ever was a perfect time, to drop us a line or pick up the phone and give us a call and let us know kind of what challenges you're facing, what would be the most value add moving forward. We want to hear those things. Like I said, we're in an active design period and very much value your input. I see that IHC is now helping with the Flex Quality Improvement Program. When can we expect to hear more on this? Just yesterday afternoon, we did disseminate an email to Iowa Critical Access Hospitals. It's important to note that the Flex program is only applicable to critical access hospitals. But on January 20th, the Iowa Healthcare Collaborative was awarded the support contract for MBQIP by the Iowa Department of Public Health. MBQIP is the quality improvement activity required to meet the eligibility requirements of the Flex program. It's always kind of confusing when contracts change hands. This was the contract previously held by Stroudwater. So look for that email sent out last night. It gives you information regarding a special call we'll be having to kick off this program for Iowa Critical Access Hospitals next week, along with some important information to sort of help you navigate that transition. If you didn't receive that, go ahead and drop a line in the chat, and/or feel free to email me our contact information, which will be listed on the last slide, and we'll make sure you get that important information. With that, I think I've reviewed most of the questions that were included in the FAQ and received so far, and hope that that information is helpful to you. I will scroll quickly through the chat to see if anything has been entered so far. However, would encourage you, if you do have any other questions, now is a great time to enter them into the chat. I see somebody asking if we can go back to the contact information. We'll be happy to do that here. And the next slide show you some of our team's contact information so that you're able to reach out to us. You can see that on your screen now. Just a point of clarification, our network is inclusive today of hospitals in the states of Iowa and South Dakota, And so just want to intentionally say that this information remains true no matter what state you're in. If you're in the state of South Dakota, you're familiar with Jennifer Koch, and she will continue to be a contact for you during this time of transition. There is a question coming in regarding if we can provide any further clarification on concerns we should hold for being in a gap or a transition period without being formally engaged with a HIIN. Feel free to comment more if I'm not getting to the root of your question. But I would just say that I think I can speak for Iowa hospitals when I say they're not engaged in improving patient safety and quality just because they're in the HIIN. The HIIN is a vehicle. The HIIN is a tool belt for getting that work done. But you're doing that organizationally anyway. IHC, although we are not in contract after the month of March, while we prepare for the transition with CMS, IHC is committed to continuing to support you. So those support services will not go away. You may see some slight changes, particularly as it relates to travel. We won't be doing a lot of remote travel to your organizations. We'll be inviting you to Des Moines if you need face-to-face time. We may be trying to connect with you virtually via Zoom or via phone call. It's not to say that we can absolutely not go on site, but we'll be limiting travel as much as possible to try and be good stewards of the funds and be also able to continually support you. If you continue reporting your performance data, that will not end either. And so as it would relate to not being formally engaged with the HIIN, I don't believe that there's necessarily any concerns that you should have. But if you have something specific that you'd like to address with me offline, I'm happy to answer those questions. Not seeing any other questions in the chat. We did get a couple in preparation for this webinar via email, and so I'm just going to look quickly to those to see if there's anything that we weren't able to address in the slides. One of the questions we got is if hospitals should continue requesting resources or technical assistance or assistance with data reporting through their current clinical quality consultant. And the answer for now to that is yes, just continue to contact our team the way that you've been using. Our team very much works collaboratively together. We all have different areas of expertise and SMEs and serve as SMEs in different focus areas. So it's always a collaborative effort, but continue contacting us using the contact information listed on your screen now. And I'm looking through here to see if there's any additional. One question came through if we would like to change some of the measures that we're currently reporting on within the Compass HIIN database. Are we able to do that? The question is yes, absolutely. Those functionalities will remain the same. And if you need assistance, I would encourage you to reach out to your clinical quality consultant. They would be happy to assist you if you need help amending your work plan. We did get a question just clarifying, will we continue to get IHC reports during the transition period, such as our readmission or our opioid report? I think I mentioned this in the slides, but to confirm, yes, indeed, we will continue disseminating hospital reports on our regular annual schedule. And let's see. And do we need to sign a new agreement? Looks like was another question. Do we need to sign a new agreement with IHC at this time? And the answer is not at this time. However, once CMS has released the information, we will be communicating with you and likely based off of the requirements, asking your hospital leadership to re-engage in a renewed commitment with IHC as we move forward to the next scope of work. There is another question going through the chat. In a hospital's current HIIN agreement with a different agent was discontinued, can we join this HIIN work at this time, even though it is in mid-cycle? I'm going to interpret that question to say perhaps you're not a current member of our network, and or the administrator that signed the initial HIIN agreement is no longer leaving that hospital. Maybe there's a new HIIN administrator. We'd be happy through the month of March. We definitely still are in contract and would be happy to renew the commitment with you for the month of March, and or wait and have you renew a commitment when we have additional information from CMS. In regards to that question, I would ask maybe that you reach out to me individually. My number and email is listed on the screen, and maybe I can talk through some of the specific facility-specific nuances that you're having and help you make a decision on how we can best support you in the gap. I know we're right at the top of the hour. I'm just going to pause one additional minute to make sure no other questions are coming in. Okay, and seeing none, I guess I just want to end with, of course, showing you our contact information from our team and reiterate that we are available to continue to support you while we prepare for the next program. We value your input and suggestions and ideas. So if there is something that you'd like us to be aware of or consider for the next program launch, please do reach out. Thank you so much for your continued engagement and your partnership in this work. We appreciate your time. Thanks and have a great afternoon.